this video, we're going to be doing tracheostomy care and suctioning, beginning with suctioning. So first, I would verify my physician order, make sure my patient, ID my patient, name, date of birth, and I would begin by walking in the room, washing my hands, and assisting my patient into a semi-Fowler or Fowler's position. So we are in that position. I'm going to go ahead and cut on my suction machine, which is over here. We'll cut it on and allow it to get up to the appropriate pressure. I'm going to wash my hands again with soap and water, start donning my PPE. I'm going to be putting on a mask and a face shield today, pinching at the nose. I would be wearing a gown as well to prevent or to protect me from any splashes that may occur. So now that this is on, I'm going to perform hand hygiene with sanitizer once again, and I'm getting started with my sterile procedure. At this moment, my patient has been hyperoxygenating as well. He's hooked up to oxygen, and he knows that this procedure is going to happen. So I'm going to start with opening up my sterile field away from me. Make sure everything's in front. Okay. This here is our sterile cup. I'm going to open this up, and we have some saline, some sterile water. I'm going to lip it into the container as it's opened, lipping it in, pouring a little into our container, and then moving the solution over. Okay. Next, I'm ready to start our sterile plane. This moment, be opening up, donning our gloves and our tubing that's in this container, in this package. So starting with my non-dominant hand, I'm going to glove up my dominant hand, and then my non-dominant hand. My gloves are on, not touching the external border of our package. Our sterile tubing right here. I'm going to open this up with my non-dominant hand and transition into my dominant with our tubing, making sure that our tubing does not come in contact with anything non-sterile. My left hand, my non-dominant hand, is fixing to be dirty, so I'm going to take the tubing and connect it to the machine, giving myself a 1-inch parameter above the tubing that is now soiled. Okay, I will test moisten the cannula. I will moisten the cannula by placing it in the water and sucking up just a little bit. Okay, so once it is suctioned up, and my patient who's been hyperoxygenating, we can remove his oxygen cannula and begin by inserting our tubing into, not applying suction at this time. We would be inserting without pressing the cannula for suction, inserting 4 to 5 inches until we meet resistance or he begins to cough. And at that point, we will only intermittently suction during removal for a maximum of 10 seconds. We would assess the patient and see if he needed suctioning again, waiting 1 whole minute, giving him a rest break. I would reconnect his oxygen tubing with my non-dominant hand and cleaning out the cannula of any secretions that might have accumulated in the tube. At this moment, I would see if he still needed suctioning. If he did, I would re-administer 10 seconds maximum, only intermittently suctioning during removal. Okay, now that that is complete, my patient is doing well. He did not need to be suctioned twice. My catheter is going to be removed with my gloves, and I'm going to perform hand hygiene washing my hands again, documenting the procedure in the computer and how he tolerated it, and allowing my patient to rest. Hi, in this procedure we're going to be performing tracheostomy care and cleaning of a trach. So we will first begin by verifying my patient's order with the order that the physician has given, verifying my patient's name, date of birth, and identifying him, and gathering all of my supplies. My supplies include a tracheostomy cleaning kit, hydrogen peroxide, sterile saline, and PPE, a gown, gloves, mask, and a face shield. So now we're ready to enter the room. Hello, identifying myself and identifying my patient. We're ready to get started. So first, I'm going to perform hand hygiene, wash my hands, and don my PPE. My gown is on already. Next, we will be applying on a clean pair of gloves. Okay, I will be removing this old dressing and looking at the dressing, making sure it's not too soiled, and if it is, assess it and address it whenever I need to clean. Making sure that my patient is pre-oxygenating and has his oxygen on his cannula at that time, preparing him for this procedure. Next, I'm going to remove my gloves, wash my hands again, and with clean hands, I'm going to begin to prepare my sterile field. I'm going to open and take out what is on top, which is my gloves, and set them to the side, and my sterile drape, which is this right here, and I have a 1-inch border around the outside of it. We're going to lay the shiny side down, making sure not to touch any of the inside, so it is prepared for us. My trach is in the view. Okay. Next, I'm going to empty out the contents of our tray directly over a sterile field. With this tray, I'm going to utilize it by not crossing over our border, lipping the container of our sterile water, pouring it into our container, and doing the same with our hydrogen peroxide around our sterile field, lipping the container and pouring into our sterile field. Okay, now that is done, we're ready for our sterile gloves at this time. Okay, so I will begin by opening up my bag, my pouch. Okay. Thumbs up, applying my sterile gloves, and same for this hand, thumbs up, and applying my sterile gloves. Making sure not to touch the border. Okay, so my gloves are on, they are clean, they are sterile, and now I'm going to arrange my tray. I want to move my gauze away and organize my tray. I've got my cleaning pipette over here, and my Q-tips, and the sponge gauze that's going to go on our tray once we're done. I also have our tie here and our Q-tips. So everything is prepared on my sterile field. Now I would like to dirty my one non-dominant hand, not crossing over my sterile field, removing of the cannula very carefully, not to touch. And it has been removed, and I will drop this into the saline to be cleaned. Okay, so not crossing over my sterile field. It's in this solution to be cleaned. My clean hand, my sterile hand, I'm going to pick up my cleaning brush. Dirty hand, I will pick up the cannula and clean, making sure that my brush does not touch my dirty hand, and dipping into solution. If it was had a lot of secretions on it, I would dip it into the hydrogen peroxide, making sure to dip it back into the solution, the saline, to clean it and remove any hydrogen peroxide off of it. Okay, so at this point, this is dirty and can be tossed in the trash. With my clean hand, not touching the trash or anything, and picking up a gauze to clean, dry the outside of any normal saline, and the inside I would use a pipe cleaner to make sure that the inside was dry. Okay, so at this time, not touching any of the cannula, I will reinsert the cannula back into the trach very carefully, not to touch it because it is sterile. Okay, it has been reinserted. Now I would take my Q-tips. This is my dirty hand, so I'm not going to utilize this right now. I would take my Q-tips and clean in a circular motion from inner to outer, cleaning the stoma site, discarding, taking my Q-tips, cleaning stoma site and front plate after one swipe being done, and then taking a gauze. If it was extremely dirty, I could utilize my gauze by folding it into a flower style puff and dabbing into normal saline and cleaning that way. And once that is done, clean hand, I'm going to take a gauze and dry any remaining solution, being careful not to touch. Okay, so now that that is done, we will apply, not using this hand, we're going to still use this clean hand and administer. I'm going to have to touch the outside perimeter of this with my dirty hand. So we're going to apply our T-gauze or split gauze around the cannula, being careful not to touch anything that would go around it. And it is applied correctly. Now my sterile procedure part is done. What I'm going to do is change the change the ties that are around the neck. But before I actually undo it, I'm making sure that the ties are in a secured position and slip knotted, not actually knotted. And I will insert my new ties into the corner of my patient's trach collar and doing a simple slip knot so that it can be removed easily, like so. There we are. Slip knot. And going around on the other side. Okay. All right. Now, both sides are almost secured. Slip knot right there. And now we can remove the old ties. And by doing so, we just simply pull that tie off and remove it. And pull the old tie off. And remove it, leaving us with a clean trach. Oh, in the process, I do apologize. My gauze came off from my patient. There we go. So it is done. Thank you. And at this point, I would take off my gloves, remove my PPE, clean my hands, wash my hands, removing my PPE, and documenting the procedure and how the patient tolerated and if there was any secretions or drainage at that time.